Bismillahirrahmanirrahim. My name is Dr. Fakhriya. You are watching our YouTube channel Medicos Viewer. Today we will discuss about the histology of the endocrine system. Firstly, we will discuss about the histology of pituitary gland. Then we will discuss the histology of the thyroid gland and the histology of adrenal gland. Now, first of all, we will discuss about the histology of the pituitary gland. Pituitary gland mainly consists of two parts. Number one is the anterior pituitary. Number second is the posterior pituitary. Here, this is the third ventricle and this part is the hypothalamus. Underneath of the hypothalamus, this is the pituitary gland, and this stalk-like structure is the infundibulum. Infundibulum mainly connects hypothalamus with the pituitary gland. Interior part mainly consists of, this is called as the adenohypophysis. Mainly, interior part derives from the Rathke's pouch embryologically. It has two parts. Number one is the pars tubralis and number one is the pars distalis. Distal part is called as the pars distalis and this tubular part is called as the pars tubralis. Mainly, it contains of the five types of the cells. Here, these are the five types of the cells. These are the, number one is the somatotroph, leptotroph, corticotroph, gonadotroph and the thyrotroph. In case of the somatotroph, 50% of the cells are the somatotroph. These release the growth hormone and mainly these are acidophilic in nature. Then other cells are the leptotroph which release the prolactin. And number third is the corticotroph. Corticotrophs are those cells name represent corticotrophic hormone. These release adrenocorticotrophic hormone and beta lipoprotein. Name beta lipoprotein is the most important. Some people never understand what's this beta lipoprotein. Mainly these are the fat storage in the adipose tissue and mainly mobilization of the fat in adipose tissue. Number fourth are the gonadotroph. These are mainly consist of two types of gonadotrophs. Number one, follicle stimulating hormone and luteinizing hormone. Number fifth, the most important is the thyrotroph, which consists of thyroid stimulating hormone. These five types of cells are present in the anterior pituitary. This is anterior pituitary. Here, this part is the optic chiasma. Optic chiasma. And this part is the infundibulum, which is a stalk-like structure and connects hypothalamus with the pituitary gland. These blood vessels mainly connect hypothalamus with the pituitary gland. These are all discussion about the interior pituitary. Now we are discussing about the posterior pituitary gland. Number one, second is the posterior pituitary mainly consists of two types of these are the neuronal system. This is the supraoptic nuclei and the paraventricular cells. These release two types of cells. Number one is the oxytocin. Number second is the vasopression or ADH. These mainly neurons, unmyelinated neuron, these release the oxytocins and stored here on these points. Histologically, two types of things appear in the posterior pituitary. Number one is the herring bodies. Herring bodies appears in the posterior pituitary because these are mainly sportings. Number second is the pituocytes. Pituocytes are most presently in the unmyelinated neurons and mainly sporting these system. These two types of herring bodies and the pituocytes are present in the posterior pituitary. That we all discuss about the anterior pituitary. This name is the adenohypophysis and the posterior pituitary name represent these are the neuron. This name is the neurohypophysis. If it is adenohypophysis, then the posterior pituitary, these are neuron. That's why this is called as the neurohypophysis. Now we are discussing the histology of the adrenal gland. Mainly, this is the kidney and adrenal gland is present above the kidney. Mainly, adrenal gland consists of two parts. Number one is the adrenal cortex. Number second is the adrenal medulla. Adrenal cortex mainly consists of, name represent, it has three parts: zona glomerulosa, zona fasciculata and zona reticularis. Name you should remember GFR. GFR in case of kidney, here mnemonics represent GFR. First of all, glomerulosa, number second fasciculata, then reticularis. This is glomerulosa, fasciculata, then reticularis. Then the most important here, it is the adrenal gland and inside it is the adrenal medulla. Here it is the adrenal medulla. Now we are discussing about the histology of the adrenal cortex and adrenal medulla. First of all, we are discussing zona glandulosa histology. It mainly consists of the 15%, totally 15%, and it just beneath the capsule. Here it is a capsule of the adrenal gland. It just present beneath the capsule, and mainly consists of these cells are called as the these cells mainly are the pyramidal shape. Here it represents with the pyramidal shape, and sinuses are present of the capillaries. These are the sinusoidal capillaries. This part mainly release of the mineralocorticoid aldosterone. Aldosterone is released by zona glandulosa. Now the most important is the zona fasciculata. These are the polyhedral shaped cells, and mainly these contain 60 to 75%, and mainly thickest layer of the adrenal cortex. Thickest layer mainly consists of more than 75% or 60 to 75% ratio. Then these are the mainly two nucleuses also present in some cells. Now the most important is the zona reticularis. Here, zona fasciculata release of the corticosteroids, glucocorticoids are released through these cells. Glucocorticoid and some types of androgens are also released. Then the important is the zona reticularis. These are also polyhedral shape and mainly contain 15%. And these are the sinusoidal capillaries between the cells. These capillaries are called as the sinusoidal capillaries. It mainly contains 15%, and these release of the androgens hormone. Androgens or the sex hormone are produced through the zona reticularis. Then this is called as the adrenal medulla. We have discussed about the adrenal cortex. Now we are discussing about the adrenal medulla. Adrenal medulla mainly these are the secretory granules. These secrete the epinephrine and norepinephrine. Epinephrine and norepinephrine. And mainly these are also sinusoidal capillaries inside it, and here these cells are mainly polygonal cells or the large cells, and these cells are called as the medullary cells. Now we have discussed detail of the adrenal cortex and adrenal medulla with its histology. Now we are discussing about the histology of the thyroid gland. Mainly thyroid gland present in front of the trachea. Just we are discussing about the histology of the thyroid gland. Thyroid gland mainly its epithelium is a cuboidal epithelium. This epithelium is a mainly cuboidal epithelium. This is total thyroid follicle and other thyroid follicles. These thyroid follicles mainly combines and form of the thyroid gland. Now the most important is the cuboidal epitheliums are called as the follicular cells. Each cells contains is the follicular cells and release of the thyroid hormone, production of thyroid hormone, and mainly consist of other cells. These are the parafollicular cells. These mainly release of the calcitonin, which mainly act on the parathyroid hormone, balance with the parathyroid gland, and maintain the calcium level. These are the parafollicular cells. Hence, it is a colloidal lumen. Formation of the thyroid hormone takes place. It is rich in the thyroglobulin. And mainly we are discussing about these are the fenestrated capillaries which provide nutrition to it. And here outside is the basal lamina. Now we have discussed about the histology of the thyroid gland. Next we are discussing about the histology of parathyroid gland. Parathyroid gland, as we know, there are four parathyroid glands. Mainly its capsule connected with the septic band which penetrates through it. It consists of two types of cells. Number one is the chief cells, other is the oxyphil cells. Chief cells are the secretory cells that release of the parathyroid hormone, PTH, parathyroid hormone. And the oxyphil cell, which is most important, and its function is unknown, but these are both are polygonal cells. But it's larger than the chief cells, but its mechanism of action or its mechanism is unknown. Hence, stroma mainly consists of other part is the stroma consists of the loose connective tissue and other things present. That we discuss about the histology of the thyroid gland and the histology of the parathyroid gland. Now we are discussing about the histology of the pineal gland and the histology of the endocrine part of the pancreas. Pineal gland, which is present in the brain, this is called as the epiphysis cerebri, near the cerebrum. This is called as the epiphysis cerebri. Now here we will discuss about the histology of the pineal gland. Pineal gland mainly consists of the pinealocytes. This name with the pinealocytes which release of the melatonin. These are mainly consist of the small cells and mainly consist of two deep nuclei. These are the interstitial cells. Above the age, after 2 decades, after 20 years, here melatonin involved in the calcification process. If calcium is deposited into the pineal gland, it can change into the corpora arenacea. Here it's the slide of the middle-aged person. Here it is the middle-aged person and present with the corpora arenacea. These are the corpora arenacea, these parts. That is the most important about the calcification of the pineal gland, and pinealocytes are most involved in the melatonin formation. Now the most important is the endocrine part of the pancreas. Mainly pancreas contains two parts. Number one is the endocrine, number second is the exocrine. We are discussing about the endocrine part. These cells are the islets of the Langerhans. Mainly consist of four types of cells: alpha cells, beta cells, delta cells, and pp cells. Alpha cells are release or production of the glucagon. Mainly beta cells, which are more than 70% and involved in the production of insulin. Delta cells are involved in the production of somatostatin, and PP cells are involved in the production of pancreatic polypeptide. That we all discuss about the histology of the endocrine system. We discuss about the pituitary gland, then adrenal gland, then the thyroid gland, then the pineal gland, and the endocrine part of the pancreas. Thank you so much. Jazakallah. Allah Hafiz. Please like and subscribe our channel Medicos Fever, and remember us in your prayers. Allah Hafiz.